Ladies and gentlemen, welcome aboard the Pilot Lawyer Podcast. Thank you for your attention while this important legal information is reviewed. What you hear should not replace consultation with an attorney and should not be considered advice for your situation. On behalf of the Pilot Lawyer and your entire crew, it's our pleasure to have you aboard.
Welcome, aviators, to the Pilot Lawyer Podcast with us, the Ison brothers at the Ison Law Firm, where we discuss FAA medical certification matters for pilots and those who want to become pilots. As we say around the office, if you don't laugh, you cry. And for the next 30 minutes, whether you're laughing at us or with us, join us, brothers.
We hope to bring you the lighter side of what can otherwise be a frustrating process. So whether you're laughing at us or with us, join us, brothers, as we bring you the lighter side of medical certification, blah, blah, blah.
What can otherwise be a frustrating process.
Yeah, something like that. We've lost a little scrap of paper.
We're still winging it.
We're still winging it. After a year and a half and over 40 episodes, we never took the time to memorize the opening. So without that piece of paper, we're lost.
It's a bunch of dorks talking about stuff.
There you go. But we're one dork short today.
So we haven't told Alex, but we decided he had to leave early.
For whatever reason.
Undisclosed reason. Didn't tell his employer. He left early. And so we thought we'd go ahead and do a podcast without him. And at first we were going to just let the podcast episode drop and let it be a nice little surprise to him. But instead we thought maybe we'd cold call him during the episode just to see
how he's doing.
What's he doing? You know?
Why aren't you here?
Yeah, what's going on?
Anyhow.
But, that type of move, though, it's kind of a gutsy move, if you will, filled with testosterone. In a few minutes, I'm going to go out in the parking lot and jump a few cars with my dirt bike.
What you're hinting at is that you want to do a podcast on testosterone.
You got it.
Medical certification with the FAA.
That's right. That's what I was hinting at.
So,
Greg, you got the hint.
It's not often I pick up on the hints, but when I do, I'm often wrong.
Yeah. That's right. So, Christopher, have you ever seen someone get an FAA medical certificate while they're utilizing testosterone replacement therapy, or TRT?
Yes.
It's a very common thing. How many times do you drive down the interstate and are bombarded with billboards which identify, hey, low T, or...
Not often. I can't think of one billboard
really?
I've seen.
I see that all the time. Low T, and then
I've seen ads online for that. Which
I
is
don't
probably
know what sites you're going to.
It's probably a bigger issue. Probably shouldn't have said that.
Yeah,
but I don't think I've seen any billboards for it.
Don't ads sort of follow what you're searching these days? so
it may be even what's being discussed and being recorded.
Yeah, that's true.
Surreptitiously.
But I'm seeing billboards all the time. And then they're like showing you they're trying to break down the cost of the labs and the treatment and the exam.
All 80 miles an hour.
All on the billboard. And you're trying to decipher it. There's several around here. Anyhow, it seems like everybody...
Show me next time we're on our way to
lunch.
TRT. Yeah.
So the thing is, though, it seems like it's a very popular item. You can go online, as you well know, and seemingly easily get this TRT therapy underway pretty easily. So it's a very common thing. It's something we see a lot with pilots who have sort of initiated treatment for whatever reason. And that's maybe something we can talk to Alex about if he answers.
Well, and if we did ask Alex if he were sitting here, he would stumble and fumble around, and then we make fun of him. So we'll just save him the embarrassment.
Yeah, for now. We'll just call him and see if he knows anything on the spot.
Yeah, even worse. So the testosterone replacement therapy, TRT, right, typically is used for those that are undergoing treatment for low testosterone and commonly utilized for the treatment of hypogonadism.
That's correct.
Are there other uses of TRT that don't necessarily go... hey, we're a bunch of lawyers. Yeah. What do we know? But have you seen?
I have seen.
There you go.
I have seen TRT. And so there are other non-traditional uses, but hypogonadism is
like weightlifting or something.
Sure.
bodybuilding,
Sure.
maybe.
I don't know. Let's not talk about things we're not.
I mean, we just ate a whole bag of cookies, so what do we know about that?
We need a whole truckload of this. Anyhow, hypogonadism is the most common underlying diagnosis that we see, which I think essentially correlates to low testosterone, essentially is low testosterone. So that being said, there is a two-part evaluation when it comes to TRT with respect to FAA medical certification.
Is there like a guideline that the FAA
There's a
publishes?
guideline, yes. There's a guideline, and the guideline's pretty lousy. The guidelines for AMEs on this essentially says, after doing all right, issue. But
is that why I don't have the guideline here in my hand? That's why I didn't print it out?
Yeah, it essentially says, issue it.
I'm supposed to know. I'm flying blind here.
Yeah, it's not as simple as
There's
that.
a podcast episode, Flying Blind. Can you do it?
Can you do it?
Okay.
Sure.
So
we don't say much. No, to much.
I guess if you're IFR.
Sure.
Anyhow,
that being said, the heart of the matter is the relevant regulation 67.113, 213, and 313, all subsection B.
That's the general medical condition standard, right?
That's correct, which essentially says that you're not allowed to have a medical. We're not going to give you a medical if you have a history of any organic, functional, or structural disease, defect, or limitation that would essentially make you unable to safely exercise the privilege of your airman certificate. So in that capacity, the underlying condition, the hypogonadism was to say most commonly. The question is there a component to that which is, if left untreated, or even when treated, is going to not satisfy the regulation, which would essentially make you unsafe within the national airspace system. Now, upon some of my research, I'm a researcher, the FAA
I arched my eyebrows.
They were already arched, so it was like it looks like St. Louis in here for a second. Because of the arch there. Shout out to all the St. Louis listeners.
I made a comment and you just went too far.
It, yeah.
So anyhow, you did some research.
So
and
did
found
some
what?
research, and it appears as though the FAA's major concern with respect to low testosterone is the side effects or the symptoms that may manifest therein, which could be fatigue, sleep disturbances, anxiety, depression, and some other items.
You just literally listed every single thing I got going on.
There's a billboard out here. I can get you the number.
Drive me past it later on the way to lunch.
The thing is, though, we have seen cases where individuals may have a diagnosis of depression, and in the throes of their evaluation with a HIM psychiatrist, for example, it gets determined that, hey, you've got really low testosterone just by happenstance, or maybe the psychiatrist recommends it. And we've seen cases where the individuals go and get on testosterone treatment, TRT, and all of a sudden they feel a lot better. And that becomes potentially an underlying argument to say that the risk for recurrent depressive symptoms has been mitigated through TRT.
So now,
it might have.
Are you closing a door and opening another by doing that?
I'm closing a door, opening another.
Like you're closing the door on the concern for depressive symptoms.
Yeah, but then I'm opening this easier. It's more like I'm in a hangar and I close the hangar door, and then I walk over to the toolbox and I open this little tiny drawer where I'm holding, some tiny lug nuts and small screwdrivers. I'm taking a big issue and turning it into a much smaller issue.
I don't understand how any of that none of that made sense.
No. I shut the big door. I put the door down, which is resolving the anxiety or depression question. And then I went over here and I dealt with this little tiny thing, which is the TRT.
At no time in your incoherent and rambling response did you make any sense. I award you no points, and may God have mercy on your soul.
Yeah. It made sense to me, and that's why maybe I have low testosterone, among others.
But anyhow, what you're getting at is that you can take a more complicated issue and kind of segue it into something, if the medical evidence, if the medical evidence supports it, and say, hey, listen, but here's a more acceptable answer for why that's going on, and this issue over here, which we're now going to say you have, because medical evidence supports it. This is easily taken care of.
Yes, sir. So I think that's the underlying thought process with respect to the condition itself, and really the idea is, why do you have hypogonadism? Is it, what's the deal with it is really what the FAA is looking at. In and of itself, it's not a specifically disqualifying condition. So you can have hypogonadism, but is it going to cause a problem while you're flying is really the question needs to be answered.
These catch-all provisions in the Federal Aviation Regulations regarding medical certification, these honestly are the areas that I think we like to kind of find ourselves in because it gives us more leeway to make argument for medical certification. If you can find competent, qualified medical judgment that would support the eligibility.
That's absolutely right, Christopher. Very good.
How's that pretzel?
Now I think the question is, okay, I'm being treated for it. Is the treatment itself, that's the second prong of the analysis. Is the medication itself going to cause me a problem? Now,
which also brings up that brings up an interesting point real quick, is that we've talked about a condition, we've talked about treatment, and now we're going to talk about medication, right? Well,
that's the same.
When I say treatment, forgive me. You sought counseling or whatever, right? What is it? An evaluation.
Sure, you've been evaluated.
You've been evaluated to be diagnosed with the condition. Now you're going to get treated with it with a medication. My point here is that there's 3 opportunities for you to have put this down on your application.
You're jumping way ahead.
Okay.
Well, hey, listen, that's a little taste.
It's a teaser of where we're.
It's like going into Baskin Robbins, which they've asked me not to do anymore, and getting a sample of those tiny little spoons.
You can't bring out your own spoon.
Yeah, apparently not. Security at Baskin Robbins is pretty tight, as I've found.
Sir, this is a tablespoon you want. Okay.
Has your FAA medical certificate been denied? Are you concerned you may not be able to get a medical certificate from the FAA? Are you at risk for FAA action for failing to report your medical history appropriately? Call the pilot lawyer at 1-855-FAA-1215 to discuss your options for getting the FAA to issue your medical certificate and get you flying. We are happy to evaluate your case and discuss with you a plan for presenting your case to the AME or the FAA. Aviation law is all we do, nothing else.
So the medications, can you use testosterone replacement therapy? The general answer is yes. If you look on the FAA's website, it sort of comes across as a resounding yes if you're taking oral medications or other types of forms of TRT. It's really hard to find something on their website really about TRT at all, let alone anything that's discouraging. However, from experience, we have seen cases where individuals have been denied due to certain TRT uses. And the problem is that, again, they don't really publish a specific list of, that would be a nice thing. If the Federal Air Surgeon or whomever wanted to just come up with a database website. I know there are some places that have that. Why do we have to have these third parties sort of saying, why can't they just say, hey, here are the medications currently that we're accepting, here are those that are not?
Are you advocating for the obsolescence of our profession?
I'm not advocating for the obsolescence. I'm advocating for the opaqueness of the federal government. I want them to be opaque.
Opacity?
Opacity. I want them to be transparent.
Yeah.
Opaque.
Is opaque and opacity? It doesn't matter.
It doesn't make any difference. The fact is they don't have anything saying what their list of medications that are specific. I think there is a do not issue medication list. It's more generic, but I want a comprehensive list. I think that would be nice. So all I can say, though, is through experience, we have some medications.
Opaque materials do not allow transmission of light waves. So you don't want it to be opaque.
Are you sure?
Listen, I'm looking at.
Who are you talking to, Merriam or Webster?
I'm talking to Google.
That's crazy. I thought opaque.
By definition, opaque means light cannot penetrate. 100% opacity. You want translucent.
I want translucent. The word.
Yeah.
Translucent.
I knew something wasn't.
Something wasn't clicking.
Thank God for the internet.
Yeah, thank God.
Anyhow.
Which will very soon take our profession, and nobody will want to deal with us.
Well, maybe this podcast does that.
Yeah. So anyhow, translucent, we advocate for that. Just be transparent. Everybody wants everybody to be transparent. I was trying to come up with another word. Just couldn't do it.
Okay.
So that being said, the question at issue is what medications are disqualifying. We have seen enclomiphene, nandrolone, and biocompound testosterone pellets to be disqualifying.
Why is that, Captain?
I don't know. Now, some of these items I have seen are not FDA approved, which is a problem for the FAA. Medications have to be FDA approved. There's a process where even after FDA approval, the FAA is not always entirely thrilled. There has to be a period of time where it has been accepted and so on. So,
do you think those situations where you saw those things that were disqualifying were maybe because people were on other medications?
No. I know specifically, especially on this biocompound testosterone pellets, we've seen that be something that in and of itself they don't like.
Interesting.
So that also gives them the impetus to potentially deny you under 67.113, 213, and 313C, which essentially says that there should be no medication or other treatment that the federal air surgeon, based on the case history and appropriate qualified medical judgment relating to the medication or other treatment involved, finds would make the airman or applicant unable to safely exercise the privileges of their respective airman certificate. Now, let's say you are taking an approved medication. Medications that we see quite commonly used are anastrozole and enclomiphene. Those are approved by the FAA. And in those cases, the FAA wants to make sure that you're not experiencing any side effects that would be aeromedically significant. Right? You're not having any problems with focus, so on and so forth. That is an inquiry that your AME will essentially assess, and then later on, the FAA may assess as well. So the question is, how can we best prepare for an application when we're being treated with TRT?
I think we should call Alex and ask.
Okay, let's get him on the line.
It's deceiving.
Hello.
Is this Alex?
Yeah, speaking.
Thanks for joining us here on the Pilot Lawyer Podcast.
Hi.
We've decided to do a podcast without you.
Checks out. Waiting to be ousted.
But nonetheless, we wanted to ask you a question.
Go ahead.
Where's the men's room key?
Well,
So we're talking about... we don't care about your answer. We're talking about testosterone replacement therapy. You know anything about it?
not a whole lot.
The guy's got 3 kids and a smoking hot wife. I don't think he needs testosterone
I
replacement
need the
therapy.
testosterone.
Well, yeah.
But
So,
be that as it may.
as expected, this was a wasted call.
Alrighty.
Big
Well,
surprise.
we didn't want to leave you out on this episode. So now that you've said probably about all you would have said anyhow, we're going to hang up.
All right.
Is it kind
Good
of
luck.
creepy that you just identified your sister-in-law as smoking hot?
No.
I questioned it.
I think she'll appreciate it.
It's still weird. And what I'm sitting across from you now. Okay. Goodbye.
Godspeed.
See how my wife feels about that.
Yeah, the whole thing is weird. So what we got here is on your medical exam, on your medical application, you're going to want to report your TRT at question 17A if you're currently using that as a medication. Now, some of this TRT, as I understand it, is through injections that you're probably not taking every day. The question is, are you currently using it? Well, if you're using these injections and you've had recent treatment and you're going to anticipate additional treatment, you should report that question 17A as a current medication. So prior to submitting your exam, though, it would behoove you to work with your treating physician to generate what they call a detailed clinical progress note to establish exactly what the underlying condition is or issue is, what the status of that underlying condition is, and then further discussion of your medication and ensuring that you're not having any side effects or experiencing any symptoms, breakthrough symptoms, to make sure that the medication is effective and have essentially the doctor generate a letter to that effect or detailed clinical progress note so that you can present that to your aviation medical examiner either before or at the time of your exam. You want to have that ready to go at the time of exam so that you don't end up with the AME saying, hey, I can't issue this or I need to defer this. And then you're in a spot where you're having to wait for the FAA to issue your medical certificate thereafter.
Wait. I zoned out there, which
Much to my surprise.
Surprising. But are you saying that this is something that the AME can issue even if you have it?
That's right.
So
Now, if you're not taking a disqualifying medication, the underlying condition is not having any aeromedically significant concerns, and you're not experiencing any side effects from the medication that are aeromedically significant, the AME should be able to issue the medical certificate. Now, if you walk in there and it's all loosey-goosey, I don't know if I'm experiencing any symptoms, or I am experiencing symptoms, or I'm experiencing side effects, or I'm taking a disqualifying medication, you're at risk for a deferral and then further scrutiny by the FAA.
But even if you get deferred, though, it's not the end of the world. It's still possible to establish your eligibility.
It should be if you meet all those criteria. But if the AME is deferring you, things aren't looking good, Paco.
Well, I mean,
unless the AME
doesn't look good looking at me.
Yeah, it doesn't. It doesn't. But all I'm trying to say is that you should be well prepared before you go to the AME. Don't get caught later on with them saying, "Hey, we can't issue this." So, all that being said,
so what can a lawyer do here for you?
A lawyer can make sure that I don't know. You tell me.
I asked the question.
Well, a lawyer can essentially make sure that the documentation is appropriately in place, that you're satisfying the criteria of this regulation, and that putting your best foot forward with respect to the documentation that will go to the AME and to the FAA so that you can establish that you don't fall afoul of 67-113, 213, 313, B, and C.
You think they can do that?
I don't know. It depends on who it is. After this podcast, I wonder if it's really us. Just kidding. It's definitely us. All right, I think we're flaming out our left engine. Christopher, got any last-minute thoughts before we ditch?
Well, the right engine's been out for a while. So we better hurry up and put this baby on the ground.
All right, if you have TRT, you're utilizing TRT, it is doable. Really just watch and make sure you're not taking disqualifying medication. I think that's going to be your biggest problem. And then beyond that, you're not having any other type of aeromedically significant problems. You're not having any cognitive fog, cognitive deficiencies that may warrant an evaluation for neuropsychological evaluation. And again, this is more focused on hypogonadism, just low T. There may be other things, like we said at the top of the hour here, that maybe you're using it for, that doesn't really focus on those types of underlying conditions.
But for the love of all, make sure you accurately fill out your application.
Yeah, you don't want to end up in a spot where you fail to report this, and something as potentially simple as this, the FAA says, well, hey, you falsified.
Not to deminimize it.
Yeah, not to deminimize it. Is that a word?
Deminimize.
Yeah, it was not to be. You don't want to be opaque about it.
Yeah, there you go.
Yeah, so you want to be very translucid.
Because
is it translucid or translucent?
Transparent. It's translucent, transparent.
It's translucent.
You want to be an open book.
Yeah, you want to be translucid.
Because as Anthony said, something as simple as this condition that could very easily result with you getting a medical, why turn it into something that ends with your certificates getting revoked?
Translucid and translucent are both adjectives that mean something is clear or transparent. But translucent can also mean something is less than completely transparent.
Well,
it's kind of a circular word.
I guess translucent is about where they're at with the the medications. We kind of know what they are, but we don't know.
I think it's opaque.
Yeah, it's opaque.
All right. Well, you've wasted another 30 minutes. You've logged another half hour. Uneventful. Let's say it again. You've logged another uneventful half hour listening to the Pilot Lawyer podcast. And even though they're putting up billboards,
Alex's wife is going to.
Yeah, that's true.
Tonight she knows me now.
Even though we know Alex has been paying attention to the billboards, we're two of the Ison brothers wishing you farewell.
This is thepodcastfactory.com.